Welcome to your first aid training course. In this video, we'll be reviewing everything you learned in your initial first aid training class. If you didn't take that class already, then stop watching this video, you little cheater. This training is meant to refresh your memory on how to handle different first aid situations. To begin, can you remember what's in your first aid and OSHA kits? Let me show you. What does this do? Yeah, that's not... I don't think this is even the right bin. Note to self, read the labels. First aid kit. The things in your first aid supply kit are first aid manual, adhesive bandages, various sizes, sterile compresses, various sizes, adhesive tape, cleansing wipes, scissors, tweezers, oral or surface thermometer, ice pack or cold pack, mild liquid soap, eye irrigating solution, disposable gloves, hand sanitizer, CPR mask. On the other hand, the OSHA kit doesn't have a table of contents. Guess we're gonna look inside. Some glasses, you got gloves, non-sterile basic spill cleanup kit for fast, efficient, and safe cleanup. A pooper scooper, blood bags, and like a whole bunch of masks. Basically, it's a bunch of stuff you use to clean up bodily fluids. Remember, it's your responsibility to make sure that the bins are stocked, not to throw everything out of them like I just did. I should clean that up. Now that you've got your supplies, the following is a rapid-fire reminder of all the different ways you can apply first aid. Let's save some lives. Booyah. Number 1, trouble breathing. If you notice a person's breathing is too fast, too loud, too slow, or too irregular, then this is a sign that they might be having trouble breathing. At ACR, if anyone is having trouble breathing, we should call 911 immediately. Don't be afraid of calling 911. It's better to be safe than sorry. 911, my mannequin isn't breathing. What should I do? Number 2, stroke. The acronym FAST can help you remember how to recognize a stroke. Facial drooping, arm weakness, slurred speech, and time the event. If you ever suspect stroke, make sure you call 911 right away. A stroke is called by a blood clot or leak in the brain, so we need to act fast. Get it? We gotta act fast when you recognize fast. Number 3, allergic reactions. Some signs of allergic reactions can be trouble breathing, swelling of the face and tongue, and what looks to be a stroke. This can be confusing, so make sure you know your residents' allergies and their history of reactions. Some residents also have EpiPens, and make sure that you know how to use these because I don't. If an EpiPen gets used, make sure you call 911 immediately. 911, my EpiPen is having an allergic reaction. What do I do? Number 4, heart attack. Heart attack symptoms include nausea, weakness, lightheadedness, pale skin, sweat abundance, pain, pressure in the upper body, including back, neck, chest, stomach, jaw, or either arm. You know, there's a myth that a heart attack is only caused by pain in one arm. That's not actually true. Don't spread that myth. Don't be a myth maker, be a lifesaver. At ACR, we don't give aspirin right away like some people do. Can you guess what we do? Call 911. 911, my heart is under attack by Nerf guns. Oh, no. Number 5, fainting. Symptoms of fainting include getting dizzy or becoming unresponsive for less than a minute. Try to catch this before the person falls over and injures themselves. Lay the person down and keep them down until they're feeling better. Would you let me up? No, stay down, you're still sick. No, I'm really not. Number 6, seizures. There are many kinds of seizures. Full body jerking, staring off into space, limp limbs and meandering eyes, all sorts of things. If you work with a resident who has a seizure history, make sure you understand what their seizures look like. If you're unsure, just talk to another staff member about what to expect. Regardless of the type of seizure, there are a couple things that you should do. Make sure you time the event, move other objects out of the way, and don't touch the person. Oh, and if there's any other things in the resident's daily book, make sure you check those and follow protocol. Got anything for that one? Nope. I'm gonna leave that one alone. Good. Let's speed things up a little. Number 7, mouth bleeding. If a resident's mouth starts bleeding, simply use gauze to apply pressure to the spot until it stops bleeding. Number 8, nose bleeding. If a resident's nose starts bleeding, tilt the head forward, not back, and apply pressure. Call 911 if the bleeding is heavy or for more than 15 minutes. Number 9, external bleeding. If a resident starts bleeding externally, use gauze to apply pressure until the bleeding stops and don't remove the gauze because it can rip out the clot. Once the bleeding slows down, wrap it with a bandage. Number 10, shock. Shock can be caused by a loss of a lot of blood, a heart attack, allergic reaction, and many other factors. Some signs of shock are weakness, dizziness, feeling faint, nauseated or thirsty, pale or gray skin, restlessness, agitation, confusion, cold, clammy skin. Have the person lay on their back, cover them with a blanket, and perform CPR if they become unresponsive and have no pulse. Number 11, tooth injuries. If a person's tooth comes out, put it in egg whites, coconut water, whole milk, or saliva to keep it alive. Go directly to the dentist or ER. Number 12, amputated limbs. If a person's limb is ever amputated, make sure you rinse the limb in cold water, store it in a bag that is inside of another bag of ice, and apply pressure on the limb that remains. Then, obviously, get to the hospital. Number 13, internal bleeding. Internal bleeding is much less visible than other injuries and can be caused by a car crash or falling or getting hit in the chest with a giant gummy bear. Look for shortness of breath, coughed up or vomited blood, pain in the abdomen or chest after the injury, or signs of shock without any external bleeding. Number 14, concussion. To recognize a concussion, check for stunned or dazed vision, headaches, nausea, vomiting, dizziness or unsteady balance, double vision or flashing lights, memory loss, loss of memory, and confusion. Always make sure to ask if they've played kickball in the past 5 minutes. Number 15, spine injury. Spinal injuries can be caused by falling from a tall height or car crashes or bicycle crashes. Look for a tingling or weakness in the extremities, pain or tenderness in the back or neck, intoxicated behavior, and lack of awareness. Make sure that you do not move the person. Let the medical professionals handle it. Which means, of course, that you should call 911! Number 16, sprain or broken bones. To treat a suspected sprain or broken bone, hold a towel with a bag of ice and cold water on the area for up to 20 minutes. Number 17, burns. If a person receives a small burn, cool the area with cold but not freezing water for at least 10 minutes. Then dry the area and cover it with a dry, clean, non-stick dressing. If they are still on fire, do the classic stop, drop, and roll. If the burns are large, well, I think you know what to do. Number 18, bites and stings. Remember to be proactive about bug bites and stings. Bring bug spray with you, and if you can, try to apply it before going to somewhere where you could get exposed. In order to treat tick bites, use a tweezers to grab the tick as close to the skin as possible, but try not to pinch it. Then lift the tick until the skin tense and wait a few seconds for it to let go. Then wash the area with soap and water. In order to treat bee stings, use the flat end of something like a credit card to remove the stinger. Then wash the area with soap and water and apply ice for up to 20 minutes. I recommend doing this with real things because I find that mime items are not as effective. Number 19, heat-related emergencies. Dehydration, heat cramps, heat exhaustion, and heat stroke can all happen because of a lack of proper clothing. And of course, plenty of water. Symptoms of dehydration include weakness, thirst, dry mouth, dizziness, confusion, and less voiding than usual. Dehydration can get worse and leads to things like heat cramps, heat exhaustion, and eventually heat stroke if not treated. The signs of heat exhaustion include nausea, dizziness, vomiting, muscle cramps, fatigue, fainting, and profusive sweating. If a resident suffers from heat exhaustion or heat stroke, call 911 right away and have them lie down in a cool area. Remove any extra clothes and then have them drink something with sugar or electrolytes in it. After that, spray them down with a little bit of cold water and cover their armpits and their neck and their groin with a cold cloth in order to lower their temperature. Number 20, cold-related emergencies. The best way to prevent cold-related emergencies is to be proactive about what you wear and how long you are exposed to the cold. Frostbite happens because of prolonged exposure to the cold. The symptoms of frostbite include white or waxy skin or cold, hard, and numb skin. If the person is damp, pat them dry and then remove any tight layers like jewelry or other clothing. After that, put on warm clothes or blankets. Do not thaw the area if you think it will get frozen again. Do not rub the area. Be very gentle. Hypothermia is a different problem. It can happen in the rain or the cold. Symptoms include cool skin, low temperature, shivering, confusion, change in personality, sleepiness, unconcerned about their condition, stiff or rigid muscles, and blue skin. Get the person out of the cold and remove any cold or wet clothing, and then cover them with a blanket. Above all, call 911 if the person needs any more help. 911, my snowball has frostbite. Can you help me? Number 21, poison. If you think a person has ingested a poisonous substance, call 911? Nope, not this time. You should call Poison Control. The number for Poison Control is 1-800-222-1222. And that's it. Way to go! We just covered 21 different emergency situations. Hopefully this brief refresher has reminded you of all the different aspects of first aid, and you feel empowered to go out and save lives, if you need to. Well, see you around!